We've got a number of ways that we communicate with the patients to try to make them aware that the health records are available online. But I'd have to say our primary resource really is the physician. The physician is the most trusted asset between the patient and the medical provider. So we use the physician to advocate using the portal, getting patients to sign up while they're in our facilities for another type of or for an office visit. And then at the conclusion of that office visit, reiterating that the information that we discussed today will be on the portal within 24 hours, your medication list, all those sorts of pieces of information are there. And so selling it as a valuable resource to the patient. Keeping up with all of the changes in the industry, from meaningful use to patient-centered medical home, there's tons of regulatory changes. We have a new breed of physician that's graduating from medical school that's expecting a certain degree of features and functions in their EHR, not to mention the explosion of analytics, big data, and exchanging information with other healthcare facilities. There's just an enormous amount of change in the industry, and maintaining a proprietary system means maintaining up with many of those changes yourselves. I think the biggest feature, at least from a global characterization standpoint, is really analytics at the point of care. The next wave of analytics is churning big data and understanding what's happening with population of patients. But as genomic and personalized medicine comes into the fold, finding ways to introduce clinically relevant information at the point of care that wouldn't have otherwise been available without a ton of research on behalf of the clinician. So I think that's one of the major changes you're going to see in EHRs, but it will take some time to come to fruition. So an example might be using a family history of a patient to recognize when they show up with a sore throat that it's actually something more severe than just a virus or a bacteria infection because of this patient's particular family history, along with their conditions that wouldn't otherwise be noted by the physician at that particular encounter.